Yeah, thank you. Thank you very much to ISOT for inviting me to speak and to Vivek Kute for including us as part of this program. So I'll be talking about infections and xenotransplantation. Why is this important? Well, this is coming now. What we're seeing is in the US especially and China and other places, we are starting clinical trials with kidney xenotransplant. Kidney will be likely the first organ. So the first thing is my disclosures and objectives. And then the first thing, of course, when you start a talk is you ask ChatGPT a little bit about the subject, and I did that. And I asked ChatGPT what the origin of xenotransplant is. And do you know where the first xenotransplant was actually in the world? So it was actually in India, and this is from ChatGPT. So Ganeshji is the Hindu god, of course, and the head of an elephant and a body of a human. And the idea of Ganesha as a primeval xenograft is the inspiration for the concept of xenotransplantation. So the god Shivaji first transplanted the head of an elephant onto Ganesha's body. So I thought that was a very interesting piece of history. So, what are the infections that we have to worry about in patients who receive a xenograft? So, if we look at a normal transplant, and this is a very common timeline of infections in transplant that you're all familiar with, it's in the first month, it's technical, common bacterial infections. 1 to 6 months, or now up to 12 months, is opportunistic infections related to the immunosuppression. And then long term, you get further infections depending on the degree of immunosuppression. But the model for infections in xenotransplantation is quite different. So you can have sort of three types of infections. So you can have what are called local zoonosis. So these are xenotransplant related infections that are limited to the graft. You can have infection of the xenograft by host pathogens, or you can have infection of the host by animal-derived pathogens. And this will be different in each patient. It will depend on the organ, the degree of immunosuppression, and the type of pig, the way the pig is modified, and the way the pig is raised that will determine what infections the recipient can get. So this becomes very complicated, but very interesting. So the first question is, well, is there an increased risk with xenotransplant? And the answer is definitely there is. So the transplant will bypass the host defenses, so there's no vector needed for transplantation. There will be an increased intensity of immunosuppression. What we're seeing in the initial xenotransplant trials is immense degrees of immunosuppression, the usual uh, stuff that we're used to, but also, anti-CD40 and many other agents, anti-TNF, anti-IL-6, many other agents being used in these patients. Also, in red here is that really many of these organisms we don't actually have assays for. We don't have a good way to detect them, and patients don't have pre-existing immunity to swine pathogens. And also, there's going to be organisms where we don't really know what we're seeing, like we might not realize we've never heard of the organism before. And so there's kind of four different categories. There's kind of the traditional zoonosis, like toxoplasmosis. There's species-specific agents, so these are like porcine cytomegalovirus. There's other potential pathogens that we know infect multiple species, like adenovirus. And then, of course, there's unknown pathogens, and I'll spend a little bit of time talking about those. Now, what about viruses? One of the main things we worry about is viruses, and these are just this is just a list of some of the pig viruses that are out there. And so some of the important ones are things like porcine CMV, porcine endogenous retrovirus, but there's also porcine coronaviruses, there's other porcine herpes viruses. So there's a big long list. Now, why are we so worried about viruses? Because the viruses are harder to diagnose. Almost all of these viruses, there's actually no treatment for. We know that viruses activate inflammation and can precipitate graft rejection and injury and predispose to other infections. And so this is what the timeline of infections after xenotransplant would look like. And you can see it's really, really complicated. and it's going to be very challenging to manage these patients. But this is going to happen. There's a lot of money being poured into xenotransplantation, and what's going to happen is these companies, eBiogenesis, or United Therapeutics, or many other companies, are going to be selling these kidneys for transplantation. And so we're going to see the patients getting routine infections, but then we're going to see the porcine bacterial and fungal infections early, then a whole bunch of viral infections, and then possibly unknown pathogens as well. Now, let me just talk about, I'm just going to talk about a couple of pathogens which I think are important. So the first is what's called a porcine endogenous retrovirus. So we all have retroviruses in us. So humans have what are called human endogenous retroviruses, or HERVs, and pigs have what are called PERVs, or porcine endogenous retroviruses. And this is the pig genome here, and you can see interspaced within the pig genome is these PERVs. And the idea is that when you transplant the kidney, all the cells will have these PERVs, and they'll reactivate, or they may reactivate, and then they may infect human cells. So there's three types of PERVs that we know about, A, B, and C. We already know that PERV A and PERV B are capable of infecting human cells, whereas PERV C only seems to infect pig kidney cells. So far, there haven't been any human PERV infections detected, but there's very few allogeneic xenotransplants been done so far. There's a handful, but there's about 200 individuals who have been exposed to pig cells and tissues and have had PERV assessment and not found any. So, okay, so imagine the future. This is like a future scenario, and I think this is actually pretty realistic, okay? So it's about 2045, okay? So maybe about 20 years from now. Okay, humans have colonized Mars thanks to Elon Musk. AI has hopefully replaced the government. And then what you'll see is perhaps the vast majority of modern transplantation of kidneys is through xenotransplantation. So can you imagine that? So there would be no shortage of organs. People will buy their kidneys from these companies. So there's a patient. I mean, I just called him Sanjay Gupta. So I hope nobody here is named Sanjay Gupta in the audience. But so he's the 100,000th recipient of a xeno kidney. And up till now, there's been no real major infections, just minor treatable xeno infections like porcine CMV. But he's 5 years post-transplant, and both him, and he's a little bit of a ladies' man, so he has multiple girlfriends, and one of his girlfriends presents with a chronic fever, leukopenia, weight loss, and develops PCP or PJP pneumonia. And both their serum is positive for reverse transcriptase activity and positive for an undescribed variant of PERV. So what's happened here is that there's been 100,000 xenotransplants without any problems, but he has now developed a PERV infection, and he's passed it on to his girlfriend, who is not immunosuppressed. And this is basically how the next pandemic would start. And you might ask yourself, well, is this possible? And I think actually it is possible, and we haven't really thought about it enough. So the first question is, well, do retroviruses ever jump between species? Can a retrovirus go from an animal to a human, and has that ever happened? And the answer to that, it has happened, actually. It's happened multiple times. So it's happened with SIV, simian immunodeficiency virus, has in multiple occasions resulted in HIV, and it resulted in the HIV pandemic that we see. So we've seen, multiple types of HIV being transmitted from monkeys to humans. So it actually has happened. It's also happened in other species. So, for example, there's a bat retrovirus that resulted in a koala retrovirus, which causes a syndrome very similar to HIV. And even PERVs in pigs come from retroviruses from other animals. So this could very, very well happen. And the worst case scenario would be if it's a low probability event, so less than 1 in 10,000 xenotransplant. So it's not picked up. It would be impossible to pick up. Also, if it resulted in prolonged asymptomatic infection like HIV does, it would be very hard to pick up. And if it's easily transmissible via sexual intercourse, and this would result in kind of the next HIV pandemic from occurring as a consequence of xenotransplantation. So I think this is, maybe it won't happen, but I think it's something that we should all be aware of. What you can do, and some companies are doing this, is you can inactivate PERVs in pigs. So you can use CRISPR-based technologies, and you can just do a CRISPR-based inactivation of one of the genes in the PERV. There's multiple different genes, but you can inactivate one of the kind of key genes in the PERV virus, and this would hopefully prevent this from happening. And actually, so the eGenesis pigs, they have inactivated PERVs to the best of their ability. So they've done about 59 gene edits just to inactivate PERVs. But the United Therapeutic pigs, they have not inactivated PERVs. They don't feel that it's important at this stage to inactivate PERVs. So there's both types of kidneys will likely be commercially available. Now, what about porcine CMV? I think I'm kind of a CMV guy, so I'm really interested in this. And porcine CMV so far only seems to replicate in pig tissues. It does cause this consumptive coagulopathy, and it can result in kind of this rejection and coagulation within the allograft. So I think it's a pretty important pathogen. And is it going to be an important pathogen in kidney to human transplantation, pig to human transplantation? Well, I think it is, because one of the very first xenotransplant recipients got porcine CMV. So this gentleman who got a heart, and he was, I think, the first xeno heart, and it was done in the United States, and he passed away about 6 weeks after his transplant, but he developed porcine CMV. And interestingly enough, so this graph shows that this is porcine CMV detected in his kidney, in his heart, his xeno heart. But interestingly enough, it was also detected in all his other organs, in his liver, in his kidneys, and so forth. And he was on ganciclovir prophylaxis, of course. And what happened was, in the blue is the porcine CMV viral load after transplant. So you can see, despite being on ganciclovir prophylaxis, the viral load went to above 100,000. So then he got cidofovir, which really didn't work, and the viral load continued to go up, and he eventually died. I mean, it's not clear how he died exactly. His heart stopped functioning, and it's not clear what role the porcine CMV had, but he definitely had an infection with porcine CMV, so which I thought was very interesting. So I'm just spending the last 5 minutes or so just talking about, well, what can we do? Like, what's the strategy here? How can we prevent any of this? So there's kind of 4 things that we could do. We could do a surveillance of the pig. We could do a surveillance of the recipient. We could look at what syndromes the recipient would have and manage it. And we could do infection control for the recipient, for the healthcare workers, and the close contacts. So the first part is recipient surveillance. Well, we need some tests to be able to do surveillance, right? So probably serology is going to be for pre-transplant, but it won't be terribly useful. Of course, we need the routine cultures, but we need PCR assays for a lot of these pathogens. And then I think really what we need is a metagenomics-based assay. So we need a microbial, a cell-free DNA type sampling, and using a metagenomics platform to pick up all these viruses. And that's how this porcine CMV was picked up in that heart transplant recipient, was using a metagenomics type. And metagenomics assays are becoming much more commonly used, especially in North America. We're using a lot of those to diagnose like FUO in transplant patients. So these are going to be very important for when we do xenotransplant. And the other thing is that we have to figure out how to manage these syndromes. So, a common syndrome you might see is someone who's 2 months post-transplant, xenokidney, comes in with fever, diarrhea, leukopenia, and elevated LFTs, right? So this is like the most common thing we see in transplantation. And it could be either a human pathogen like CMV, or it could be a swine pathogen. So if you see one of these patients, well, you got to say, okay, I'm going to isolate the patient. I'm going to look for the regular human stuff. I'm going to do all the cultures, look for CMV and so forth. But then I'm also going to look for the pig pathogens as well. So you have to, eventually start thinking about that. And that's, I think, when you're going to need, maybe in India, I know maybe there's not as much transplant ID consultation, but I think perhaps when this comes, you'll need a little bit more transplant ID consultation. And you'll need to think about some of these tests that you need to order. So you need to look for all of these viruses, PERVs, porcine CMV, porcine circoviruses, and a lot of these are going to be based on PCR type testing or metagenomics type testing. Now, the last two, well, what about infection control considerations? And you can see this is picked up from a review published a couple of years ago on the infection control considerations. And you can see it's pretty complex here. So it includes infection control considerations for the faculty, the staff, the OR staff, the hospital staff, and then, of course, for the patient, and then for the community. And I'm not going to go through this, but I want to highlight the community piece. So what they say is you need to monitor for illness in close contacts, you need to biobank serum of close contacts, and you need a coordinated monitoring and surveillance by public health authorities. So that's pretty challenging. I can tell you in Canada, this would never happen, basically. We just don't have the resources to do this kind of thing. And I think anywhere in the world, if there's a lot of xenotransplantation, this will be very unlikely to happen over the long term. So here are some take-home messages. So one is that the first is you have to ensure that the pigs are safe to use. So they should be really raised in a pathogen-free facility. They need to be genetically modified. Ideally, they need to have PERV inactivation. You need to characterize, I think we still need to characterize what are the infection risks, and we'll learn that from the clinical trials that are ongoing. What are the pathogens, the biology, and the impact? We definitely need assays to diagnose these, and then we need preventive strategies. We need a drug for porcine CMV, for example. There's no currently available drug. And then I think this will help with doing this safely. But then also I think, and this hasn't been thought out enough, is what's the safety beyond the xenotransplant recipient? Like what's the safety for the close contacts and stuff? And of course, the last thing we need in the world is another pandemic, and we certainly don't want to start that pandemic as transplant doctors, right? So this is an interesting quote by Donald Rumsfeld, who was the Secretary of State for the United States during the George Bush era. And so he said, there are known knowns, so these are things that we know. Then there are unknown or known unknowns. So these are things that we now know we don't know. But then there are also, and this is what we're worried about in xenotransplantation, is the unknown unknowns. So these are things we do not know, we do not know. So it's a little bit confusing, but this is exactly what we should be worried about in xenotransplantation, is the unknown unknowns. It's like the things we have no clue about that might create a problem. So I think it's pretty exciting time that we live in, that we're actually talking about all of these things. But it's going to certainly result in fresh challenges. So with that, thank you very much, and I'm pleased to take any